What if I told you that right now, your liver could be quietly failing, and the only warning signs have absolutely nothing to do with your stomach? No belly pain, no nausea, just strange, easy-to-ignore things happening in places you'd never expect. Things like itchy palms, a change in your handwriting, or a smell coming from your breath that no amount of mouthwash can fix.
Here's the thing that worries me most about liver failure in older adults, and I've seen this happen far too many times. Most seniors are dismissed, or they dismiss themselves. They chalk it up to aging. They think, I'm just tired because I'm getting older, or my skin always does that. But those small, strange signs, they're your liver desperately waving a flag, begging you to pay attention. Stay with me through this entire video, because sign number 7 is the one that shocks people the most. And sign number 11 is one that almost every doctor misses in seniors over 65. You do not want to skip ahead. And before we go any further, if you're watching this and you care about protecting your health and the health of the people you love, please hit that subscribe button right now. Every single week, we break down complex health topics into simple, clear information made specifically for you. We're not here to scare you, we're here to prepare you. Now, let's get into this. First, let me take just a moment to talk about your liver, because I think once you understand what this organ actually does for you, you'll realize why we have to take it seriously. Your liver is about the size of a football and sits just beneath your right rib cage. Every single minute of every single day, it is doing over 500 different jobs. 500. It filters your blood, removing toxins and waste. It produces bile, which helps you digest fats. It stores energy in the form of glycogen. It makes the proteins your blood needs to clot properly. It processes every medication you take, every glass of wine you've ever had, every chemical you've ever been exposed to. Now here's what makes liver disease particularly dangerous in seniors. Your liver has no pain receptors inside it. None. That means even when it's severely damaged, it will not hurt in the traditional sense. And your liver is remarkably resilient. It can keep functioning even after losing 70% of its healthy tissue. By the time most people notice something is wrong, a significant amount of damage has already occurred. And for adults over 60, the risk is even higher. Age-related changes reduce blood flow to the liver. The liver shrinks in size. Metabolism slows down. Medications, which most seniors take multiple of, all pass through the liver. All of this creates the perfect storm for liver stress that quietly builds over years. So, what are the signs? Let's go through all 13, and I promise, some of these are going to genuinely surprise you. The first sign is persistent fatigue that doesn't get better with rest. Now, I know what you're thinking. I'm tired all the time. Doesn't that just come with getting older? And yes, some fatigue is normal, but liver-related fatigue has a very specific quality to it. It's a deep, bone-tired exhaustion that doesn't lift, no matter how much you sleep. You wake up in the morning feeling just as worn out as when you went to bed. This happens because when the liver isn't functioning properly, toxins, specifically a substance called ammonia, build up in the bloodstream. Ammonia affects the brain and central nervous system, and it causes a form of mental and physical heaviness that rest simply cannot fix. Studies published in the Journal of Hepatology have specifically identified fatigue as one of the most common and debilitating symptoms of chronic liver disease. So if your tiredness feels different, heavier, more relentless, take note. The second sign is swelling in the ankles, feet, or abdomen. When the liver is failing, it can no longer produce enough of a protein called albumin. Albumin is what keeps fluid inside your blood vessels where it belongs. Without enough albumin, fluid leaks out of your vessels and pools in surrounding tissue. In the legs and feet, this shows up as swelling, what doctors call edema. In the abdomen, it creates a condition called ascites, where fluid accumulates in the belly, causing it to look distended or bloated. Many seniors mistake ankle swelling for a heart problem or just old age. And while heart disease can also cause swelling, if you notice that your belly is also becoming larger, firmer, or more distended, along with swollen feet, the liver deserves serious consideration. Please don't ignore this combination. Sign 3 is changes to the color of your urine and stool, and this is one of the most reliable early indicators. Healthy urine should be pale yellow to clear. When the liver is struggling, a pigment called bilirubin, which is normally processed and eliminated by the liver,
starts to build up in the blood. It spills into the urine, turning it dark brown, the color of strong tea or cola. At the same time, your stool may become pale, clay-colored, or gray. This happens because bile, which gives stool its normal brown color, isn't flowing properly from the liver into the digestive tract. If you notice both of these changes together, dark urine and pale stool, that is a significant warning sign that needs prompt medical attention. Don't wait on this one. Sign 4 is yellowing of the skin or eyes, what's medically called jaundice. This is perhaps the most well-known liver symptom, but here's what many people don't realize. In seniors with darker skin tones, yellowing of the skin can be very difficult to spot.
If they appear yellowish rather than bright white, that is jaundice, and it means bilirubin is accumulating in your body's tissues because your liver can't clear it.
Jaundice in older adults is always worth a doctor visit, because it has many possible causes, some more serious than others, and your doctor needs to determine exactly what's going on. Sign 5 is easy bruising or bleeding that takes too long to stop. Here's something most people don't know. Your liver produces the clotting factors your blood needs to stop bleeding. When liver function declines, clotting factor production drops. The result? You bruise from the lightest touch. A small cut bleeds far longer than it should. You might notice unexplained bruises appearing without any known bump or injury. For seniors already taking blood thinners, this sign can be trickier to identify, because those medications already affect bleeding. But if bruising seems to be happening more easily, more frequently, or in unusual places, consult your doctor and mention your concern about liver function specifically. Sign 6 is confusion, forgetfulness, or personality changes, and this is one of the most alarming. When the liver fails, it can no longer filter ammonia from the blood. Ammonia crosses into the brain and causes a condition called hepatic encephalopathy. In seniors, this can look exactly like dementia or Alzheimer's in the early stages. Memory lapses, difficulty concentrating, confusion about time or place, mood swings, even mild personality changes. A 2022 study in the American Journal of Gastroenterology found that hepatic encephalopathy is frequently misdiagnosed as Alzheimer's disease in older adults, delaying proper treatment. The critical difference? Liver-related cognitive decline can actually be reversed when the liver condition is treated. True Alzheimer's cannot. This is why a complete metabolic panel and liver function test should be part of any cognitive evaluation in seniors. And here we are, sign 7.
The one that shocks people. It's a smell on the breath that is distinctly sweet, musty, or described sometimes as smelling like raw liver or newly turned earth.
This is called fetor hepaticus, and it is caused by dimethyl sulfide and other sulfur-containing compounds that build up in the blood when the liver can no longer remove them. These compounds are exhaled through the lungs, creating this very particular odor that no amount of brushing or mouthwash will eliminate. This is not bad breath from food or poor dental hygiene. This is breath coming from the bloodstream itself. If someone close to you, a caregiver, a spouse, a family member, has commented on a strange, sweet, musty smell from your breath that seems to linger, please take that seriously.
It's not something to be embarrassed about. It's your body communicating something important. Sign 8 is intense, persistent itching, especially on the palms, soles of the feet, or all over the body. This is called cholestatic pruritus, and it's one of the most misunderstood liver symptoms. When bile flow is disrupted, as it is in liver disease, bile salts accumulate in the skin. The resulting itch is deep, relentless, and maddening. It doesn't respond to antihistamines. Hydrocortisone cream won't touch it. The itching is often worse at night and can severely disrupt sleep. Many seniors assume this is dry skin, eczema, or an allergic reaction and spend months treating the wrong condition. If you have persistent, unexplained itching, particularly on the palms and the bottoms of your feet, and it's not responding to any topical treatment, please bring this to your doctor and specifically ask to have your liver enzymes and bile acid levels checked. Sign 9 is loss of appetite, combined with unexpected weight loss. Now, appetite naturally changes a little with age, but if weight loss is happening without trying, and it isn't due to a change in diet or exercise, it may be another indicator that the liver is under distress. It can signal cirrhosis or advanced liver disease, where the body is struggling to function properly.
Please take these signs seriously. They may offer a vital clue that something is not right.
But liver-related appetite loss is different. It tends to be accompanied by a feeling of fullness after just a few bites, nausea at the smell of food, and often a significant aversion to fatty foods in particular, because the liver's impaired bile production makes fat digestion uncomfortable. The resulting weight loss is often rapid and unexplained. When the liver isn't functioning properly, the body's ability to metabolize nutrients is compromised, and muscle wasting can occur even when calorie intake seems reasonable. If you or someone you love is losing weight without trying and eating significantly less than usual, this combination warrants investigation. Sign 10 is spider veins or redness of the palms. You may notice small, red, spider-like blood vessel clusters appearing on the skin, most commonly on the upper chest, shoulders, face, and arms. These are called spider angiomas, and they're caused by hormonal imbalances that occur when a damaged liver can no longer properly regulate estrogen levels. Yes, even in men. At the same time, many people with liver disease develop what's called palmar erythema, a persistent redness or warmth in the palms of the hands, particularly around the outer edges. It's painless but noticeable. Neither of these alone is a definitive sign of liver failure. But together, especially combined with other signs on this list, they form an important clinical picture. A good doctor will recognize this pattern immediately. Sign 11, the one doctors miss, is changes in sleep patterns, specifically sleeping during the day and being wide awake at night. This reversal of the normal sleep-wake cycle is a known symptom of early hepatic encephalopathy, a sign that the brain is being affected by liver toxins. But here's why it gets missed. In older adults, disrupted sleep is so common and has so many causes: pain, medication side effects, anxiety, prostate issues, that doctors often attribute it to just aging without investigating further. Research published in the journal Liver International specifically identified sleep inversion as one of the earliest and most consistent signs of minimal hepatic encephalopathy in seniors. It often appears before any notable cognitive symptoms, so if you've noticed a significant unexplained flip in your sleep-wake cycle, drowsy all day, alert all night, and you can't explain it with any other obvious cause, please raise this with your doctor and ask for a liver function panel. Sign 12 is muscle cramps, particularly leg cramps at night. This one surprises people, but when the liver is damaged, it affects the balance of electrolytes, particularly zinc, magnesium, and potassium, that muscles need to function properly. The result is frequent, painful cramping, most often in the calves and legs, during the night or early morning hours. Studies have found that up to 88% of patients with advanced liver disease experience significant muscle cramps. In seniors, these cramps are often dismissed as just another getting older problem, or attributed to dehydration or medication. While those are valid causes to explore, if the cramps are frequent, severe, and happening alongside other signs on this list, the liver connection is worth investigating. And sign 13, the final sign, is nail changes. Your fingernails can reveal a surprising amount about your internal health. In liver disease, several characteristic nail changes can occur. First, there are Terry's nails, where the nail appears mostly white with only a small strip of pink or red near the tip. This happens due to decreased circulation and changes in the proteins produced by the liver. Second, you may notice the nails becoming thickened, brittle, or developing unusual ridges. Third, some people develop what's called clubbing, where the fingertips become wider and rounder, and the nails curve downward over them. This is associated with advanced liver and lung conditions. None of these nail changes are painful, which is exactly why they go unnoticed for so long, but they can serve as a quiet, visible window into what's happening inside your body. Next time you're clipping your nails or getting a manicure, take a moment to look. And if you notice white nails with that characteristic pattern, mention it to your doctor. So let's take a breath together, because I want to make sure you're leaving this video feeling empowered, not frightened. We've talked about 13 signs, some strange, some subtle, some that you've probably overlooked for years because they seem harmless. Let me quickly run through them one more time so they really stick. Deep unexplained fatigue, swelling in the legs or belly, dark urine and pale stool, yellowing of the skin or eyes, easy bruising or prolonged bleeding,
confusion or personality changes, that distinctive sweet musty breath, relentless itching especially on the palms, appetite loss with weight loss, spider veins or red palms, the flipped sleep cycle, muscle cramps at night, and changes to the nails. Now here's what I want you to do. If you recognize 3 or more of these signs in yourself or someone you care for, please make a doctor's appointment this week. Not next month, this week. Tell your doctor you want a comprehensive liver function test, also called a hepatic panel. It's a simple blood test. It measures your liver enzymes, your bilirubin, your albumin, your clotting factors. And if the results come back abnormal, ask for a referral to a hepatologist. That's a liver specialist. I also want to say something important about medications, because this matters enormously for seniors. Many common over-the-counter medications, including acetaminophen, which is found in Tylenol and hundreds of other products, can be very hard on the liver, especially when taken regularly over years. Statins, certain antibiotics, and herbal supplements like kava, comfrey, and even high-dose green tea extract have all been linked to liver stress. Please review everything you take with your doctor and ask specifically, is any of this affecting my liver? On the protective side, research continues to support a few lifestyle habits that genuinely help the liver. Drinking coffee, yes, actual coffee, has been consistently shown in studies to reduce the risk of liver fibrosis and liver cancer. Even 2 cups a day appears to offer measurable benefit. Staying well hydrated supports the liver's filtration work. Reducing alcohol or eliminating it is one of the single most powerful things you can do. And maintaining a healthy weight reduces the risk of non-alcoholic fatty liver disease, which has now become the most common liver condition in the developed world. Your liver is not your enemy. It is one of your most devoted, hard-working allies. It has been quietly doing 500 jobs a day your entire life, without complaint, without credit. The least we can do is listen when it finally starts to speak. I hope this video gave you clarity. I hope it gave you a checklist you can actually use. And most importantly,